Well, my friends, I do like to share a case of ovarian cyst cured. A successful cure of ovarian cyst. Many orthodox persons of the society, many orthodox physicians belong to modern medicine, do not believe homeopathy, do not like homeopathy. This video is for, once again, for those disbelievers about the homeopathic science. Now, what is ovarian cyst? You know from the knowledge of anatomy what is ovary and what is ovarian cyst. Well, my friends, for the general persons of the society, I do like to sketch in brief. This is an ovary or child-bearing organ of females, which lies into the pelvic cavity. There are two uterine tubes and two ovaries. This ovary is filled up by eggs. From very beginning, these eggs are known as primordial follicle. These primordial follicles gradually increased, and at every menstrual cycle, one egg becomes matured. This matured primordial follicle is now known as Graafian follicle. This follicle ruptured, the ovum comes out, and it catches at the fimbriated end of the fallopian tube, and it goes inside the fallopian tube for fertilization. This is another site that is not my intention to clarification or explanation. Now this ovary, these primordial follicles or Graafian follicles, one becomes enlarged, filled up by fluids. It becomes like a sac, and that is looks like a cyst and known as ovarian cyst. These ovarian cysts are of various types. It looks like chocolate, a big type, chocolate cyst, etc. It sometimes bleeds. Then it is known as hemorrhagic cyst, etc. So ovarian cysts are nothing but the filled up by fluids of the Graafian follicles. So ovarian cysts are common because the Graafian follicle sometimes enlarges and filled up by fluids. But when it becomes larger, more and more larger, and becomes complicated, sometimes it becomes tortuous, then the problem arises. Generally, these cysts are harmless. Most cysts go away even without any treatment within few months. But sometimes, my friends, the ovarian cyst can become twisted or burst or rupture. This can cause serious symptoms of the system. To protect the health, so regular pelvic examinations of the female is essential. Now, what are the symptoms of these ovarian cysts? The pelvic pain. Most ovarian cysts cause no symptoms, but sometimes it may cause pelvic pain, may come and go, or fullness, or pressure, or heaviness sensation of the lower abdomen. There may be sudden and severe colicky pain, etc. appears when the cyst becomes twisted. I am showing one twisted ovarian cyst picture. This is from the book of international gynecologist Dr. C.S. Da, who was a professor of Calcutta Medical College. He had written on textbook of gynecology, that is his book. I am showing the picture from his book. The name of the book is Textbook of Gynecology by Dr. C.S. Dam. And this is the torsion of ovarian cyst, when the ovarian cyst is tortured and the biopsy looks like this. That is not my matter. The question is whether this ovarian cyst is curable or not. It is, yes, it is many times curable in homeopathy, but in modern medicines or allopathy, they have no medicinal scope. They openly, from the very beginning, advise to the patients to operate it. Here is a girl, aged only about 24 years, a college student, having cyst, a very big cyst, 24 into 67 millimeter, approximately 84 into 67 millimeter cystic lesion in the left ovary. The report is dated 26th September 2024. So 2024 সালের সেপ্টেম্বর মাসে এই রিপোর্ট পাওয়া গেল, a very big cyst in the left ovary. The patient came to me. This is the report of 2024 September. At the October, the patient came and I prescribed T occidentalis in 50 millisiemens scale of potency by the symptom similarity, collection of the symptom similarity. T occidentalis was the choice of medicines by symptom case taking. After that, I prescribed, the second visit was 4th January 2025. I prescribed the next higher potencies of T occidentalis starting from 7 to 14, 0 by. And this is the third time. Before coming this time, this lady, girl, once again done the USG in 2025 February. The report is absolute normal. No obvious mass lesion or cyst is seen in the adnexal region. Left ovary is now totally normal. Is it not the success of homeopathy, my friends? Is homeopathy slow acting? So those who are claiming that homeopathy is not a science, it is a folk medicine, once again may I request you, may I appeal you, do not argue, criticize about a science, about any subject which you have no knowledge, about which you have no sound senses. So please don't criticize homeopathy. Homeopathy is a science, a perfect science, and these are the examples we are showing by the observation, inference, that even the ovarian cyst can be curable, can be manageable by your homeopathic medicines. The girl, 24 years girl, having 84 into 67 millimeter ovarian cyst, is completely gone away by 3 times medicine within 3 or 4 months, and the report is obviously left ovary is normal. So this is the time the cyst cleared. So I do like to continue the medicine in next higher potencies for not to relapse the cyst once again, and or whether any new cyst may not be formed. So please remember this video number. Once again I shall show you whether the cyst is reappearing or not, or whether any new cysts are being formed or will be formed or not. So let's see the result, my friends.